Based on all the data we have right now, the target as far as BCMA is concerned is a great target. We like that target. It's very plasma cell specific. It's not present on other normal cells, on other immune cells, and that's really quite critical to the development of these CAR T cells. So I think the target is something we do have. I do think, we are in an era where we're learning so much about these cellular products, and the next question is, can we get better with these products? Can we have armored cars? Can we go to third generation cars? And that work is already happening as we speak, because if you look at the data we presented, what we saw was T cell persistence for about 6 months or so. They last for about 6 months. So can we have a product which lasts longer and continues to have an anti-tumor activity? Those studies are ongoing, where we are taking care of the product or manipulating a product so that it can stay in the system for longer. There are a whole lot of other things we need to try and understand, right? This is still not an off-the-shelf technology. This is very patient-specific. This is very dependent on what kind of a T-cell repertoire the patient in itself has. And the other part which we don't completely understand is when we reinfuse the product, what are the T-cells doing? How many CD4s do we have? How many CD8s do we have? What is the role of NK cells? What is the role of T regulatory cells? So all of this is a huge area of interest and research, and I think over the next couple years that's what we're going to be focusing on. As far as what are we doing next, obviously because this is encouraging and we want to try and get it to more patients, we're already doing a phase 2 trial in this same kind of a population, so very relapsed refractory patient population, just to demonstrate efficacy and safety in that patient population. And then once we've done that, as in all other multiple myeloma studies, the key to really seeing long-term disease control and hopefully cure in myeloma is not to treat end-stage disease, but it is to treat earlier on. So we will be moving these trials more in the earlier lines of treatment.